Kellen with Walnut Creek City Lifestyle.
And I'm Dr. Barry Rotman from Banner Peak Health.
So Barry, this month in the January issue, we have an article on Concierge Medicine 2.0. Before we talk about that, just walk me through, what is Concierge Medicine?
What is Concierge Medicine? Concierge Medicine is a way of having the market solve a problem that's currently going on right now. And that problem is people are frustrated. They can't get the health care they want from the traditional fee-for-service model. Whether they can't get in to see the doctor's not going to call them back. Many people experience the system as being not working. Concierge medicine reflects a model where people can pay for health care out of their own pockets. And from a physician point of view, we then become beholden to our patients as our bosses, not the insurance company. And a lot of high quality care can flow through that change in business model.
And so Banner Peak Health is a concierge medical practice, and you are the founder of it.
Yes.
And what year did you create Banner Peak Health?
Wow, way back when. So opened our doors in July of 2007. And through many years, I was a solo practice. It was me. And beginning in 2023, began bringing on new doctors. Dr. Hiller joined us in 2023. Dr. Lindsay Klein joined in 24. And Dr. Ari Katz joined in May of 25. We're growing.
Yeah, that's exciting.
Yeah.
And so what gave you the inspiration or the idea to start Banner Peak Health?
Yeah, it gets back to the frustration. Just as patients are frustrated with the kind of care they receive in a fee-for-service model, as a physician, I was very, very frustrated with the kind of care that I was able or not able to provide the kind of care I wanted in a fee-for-service model. It's just time and everything was just being compromised. It was not the kind of medicine that I trained to be a doctor to provide for my patients. It's just too frustrating.
And so you learned or thought about another way of doing it.
Yes.
And what was it like when you first started? Was this a radical idea, trying to explain it to people?
Yes. So there had been one other doctor in our community a few months before who had opened his concierge practice.
Okay.
I was number two. So as I explained, the marketing task was really twofold. First was, this is concierge model, and this is why I should be your concierge doctor.
Right.
In the intervening 18 years, I think now it's just why we should be your healthcare provider, not what concierge medicine is. People have understood.
People know.
But in the very beginning, being an early adopter, that was part of my task, was explaining how it all worked.
And so what are some of the things that concierge medicine can provide that your standard doctor cannot?
Yeah, so we have sort of the magic ingredient for a lot of healthcare, particular primary healthcare, is time. A surgeon can be a great surgeon, be very fast. For internal medicine, if you're super fast with your peers, you're not a great doctor.
Okay.
It really takes time to listen to a patient. It takes time to examine a patient. It takes time to think about their case. It takes time to talk to a patient specialist, explain things. It's really a very time-dependent form of healthcare, and it just can't be compressed. And in the traditional payment model, there's just less and less time with the patient, and you can't perform to the level of care that you want to. And both the patient and the doctor can sense that frustration. So time is one thing. And the other thing we're discovering, we'll maybe get into this later in the conversation, is the concierge medical model allows us to use a lot of technology that's not available in a more traditional model. Why? One, the technology itself is not covered by insurance, and that would be an example. There's Gallery by Grail. It's this wonderful technology we're using. We could use a blood test to screen for 50 different forms of cancer, many of which could be, highly and imminently lethal. We can do that. That's not covered by insurance. The other thing we can do is use technology such as continuous glucose monitors, which are available over the counter. People can pay for them out of their pocket, but to really utilize the data they generate, which is so copious, it's very time intensive, and rushed traditional care physicians really don't have the time to leverage the technology. So either the technology itself is not paid for in a fee-for-service model, or the amount of time it takes to really implement the technology is not covered. And we have the luxury of really being able to implement technology because we have both.
So now that we have an understanding of concierge medicine, what is Concierge Medicine 2.0?
Right. Everyone 1.0, 2.0, it's a way of sort of marking an evolution
Yeah.
in a way of thinking and providing. So Concierge Medicine 1.0 was the business model that I proposed when I opened the practice. So really fairly straightforward. Are you a good physician? Yes. Will you see the patient that day? Yes. Will you answer the phone after hours? Yes. That was enough. And that was Concierge 1.0.
And that is sort of a monthly fee, I assume. Just someone is
Monthly
paying
or annual or
annual
semi.
fee. Okay.
The key concept there is that the patient provides the funding for the healthcare. I like to say, he who pays the piper picks the tune. And what I tell people is your insurance company may have a playlist that you don't like.
Yeah, 100%. I know they do.
Exactly. So Concierge 2.0 is a little bit different. We talked about that earlier, where the funding for Concierge Medicine allows us to implement a lot of different technology.
Okay.
And a lot of the technology is really targeted towards improving prevention, which is better than treatment, obviously. Whether that's a new consumer wearable that we can incorporate the information from, or a new cancer screening test that's not covered by insurance. When I think about 1.0, Concierge 1.0 was a great vehicle for what I say, preserving the best of the past traditions of internal medicine. You know, having the time to carefully do a history and physical, to think about a case, to work in the differential diagnosis. It was sort of a preservation type model. When I think about Concierge 2.0, I think more about sort of building a platform, moving healthcare into the future.
Okay.
You know, being able to bring in the newest modalities of treatment and really being an early adopter and being positioned to provide the best possible care moving forward.
And so because you're not beholden to the insurance companies, you guys can sort of research what's out there on the market. And if it is brand new technology, but backed by science and you guys believe in it, you'll incorporate that into your practice.
Yes, you understand exactly.
Okay.
What is covered by insurance reflects, unfortunately, perhaps the financial needs and interest of the insurance company,
Right.
not necessarily targeted towards maximizing the health for a patient.
Right.
That's one of the fundamental disconnects of our business model, which is very frustrating.
And so tell me about the typical patient experience. How often do people come in, and what does it look like? I guess, what does it look like that first time they come in, and then what does it look like on subsequent trips?
Yeah, it gets back to what we're talking about. We have the luxury of time. And so before I get into what we do, the nature of a relationship with patients is very different. Our statistics, like that of the industry as a whole, people sign up and they're with us for years, for decades. It's the annual retention rate is 95% plus.
Because they're just loving it.
They're loving it. The people who are not getting, people move to Seattle for a job, people pass on. That's the cycle of life.
Yeah.
But people really locked in. We sort of almost warn people when they sign up with us, this is a one-way street. You're not going back.
Yeah.
When people then move to another geographic area for work or for whatnot, and then we're sitting there trying to locate which concierge medical practice we're going to transition
Yeah.
to, they're really hooked. And so we really invest heavily in getting to know each other. And
Okay.
that investment is really primarily in terms of time. So we'll have a new intake appointment, might be, literally 90 minutes of just really, who you are, where you are, really, getting data from all the other prior healthcare encounters you've had, really letting the
Okay.
physicians analyze that. And then we have another intake, probably 90-minute appointment that's really focused on, again, where are you going? Where are your health
Okay.
goals? What the healthcare provides a little more sophisticated. Not only are we trying to prevent, not only are we just trying not just treat disease, we're trying to prevent disease.
Right.
We kind of take it the next step. If you think about why should healthcare always be referenced to where you are vis-a-vis disease? No, we want to optimize your health. So a lot of what we're doing is drilling down in how you're living your life and using technology. How are you sleeping? How are you managing stress? How are you eating? And this is wonderful and foundational for health and optimizing your potential on this planet, but it's time consuming. And we have that time and we leverage that. And it's just been a very gratifying way to practice medicine from the healthcare physician point of view. And we've been growing and hiring new doctors. So I think there's a real demand and interest for people to experience this level of healthcare.
Yeah, absolutely. Tell me about those new doctors. So who are they and how did you choose that they are a good fit for Banner Peak Health?
Right. So sort of as the founder, sort of my job is to sort of build the team. And I realized that when looking for concierge doctors, there's this concept of sort of a concierge doctor soul, if it were, that was trapped in the body of the fee-for-service physician. So one of our doctors, Dr. Lindsay Klein, I remember we scheduled one of her interviews. It was in the afternoon, and she was rushed. She was going to do her morning clinic, and then if you're rushed, okay, we'll provide your lunch. Just show up. And she was late. It was like 30, 45 minutes late. And she arrived and she was nervous and she was like eating the salad and we were talking. So why are you so late? I don't remember the details of the story, but the fundamentals were that a abdominal CT scan was ordered by a specialist and there was an abnormal finding and the patient was concerned and the specialist wasn't calling back and she didn't know what it was. Basically, she then, through her lunch hour, was trying to find the test result and call the patient because they were worried about it. She was doing what had to be done. It was the highest quality care, and she was bucking the system to do that. And that was the interview. Before the official interview, her inner sense of direction, her standard of care was that of a concierge doctor. She adhered to the highest quality of care, no matter how hard the system was preventing her from doing that.
Right.
The goal then is to identify that in a physician, bring them into a concierge model, and let them flourish, because that is their nature, and then put them, or him or her, in a practice environment that allows him or her to practice that kind of medicine. And that was the interview, just seeing that was her orientation, that was her standard of care that she had to provide. It wasn't a choice. That was just who she was as a physician. And that is the true mark of a concierge physician.
Okay. And then so Dr. Klein is here. I know Dr. Katz is here. He's done some recipes for us. Are they all sort of general practitioners, or do they specialize in certain things?
Good question. So yeah, the nomenclature gets confusing fast. So they're board certified internal medicine, which of course begs the question, what is internal medicine? It's basically healthcare for adults. There's internist, internal medicine, basically board certified. Med school is 4 years, minimum of 3 years of residency training. Then there's board certification, and that is everyone's level of training here.
Okay. And then one thing I was thinking of, if someone is interested in concierge medicine, but they're on the fence about it, or maybe the cost seems too high for them, what would you say to them?
Check out our website. So I've lost track of how many iterations of websites I've had since I opened the door. In 2007, the website was functionally an electronic, business card. Here's the address. Here's how to contact us. But through countless iterations, our current website is chock full of information about what happens at the practice. We've got videos introducing all the different doctors. We've got videos talking about our onboarding process. There's a video of me talking about how we've developed some of the content that we're talking about here today. And it really explains in detail how we're different. And yes, there is a fee involved. And when I think about explaining to somebody the price is really a ratio. It is a dollar amount in reference to what you're getting. And what we really try to do with the website and intake interviews, which are always done with our executive director, Nicole Goldberg, she has extensive discussions with everyone. We really want people to understand not only the number, but the value proposition behind the number. And we're finding people are interested and they're joining and they're very happy and they're telling their friends, and we're growing and we're hiring more doctors.
That's wonderful. Now, without going into any personal details, can you tell a story or an example of a time when someone had a great or a strong outcome medically due to the personalized care that they get here?
Okay. I'm not at liberty to go into details of any one particular person's case, but let me tell you sort of general what we offer is that there's a tremendous value to 24/7 access to someone who knows you intimately.
Mhm.
There are whole categories of situations where people are at home, they're traveling, they experience a symptom. People
Mm.
were saying, their arm was numb when they were climbing a hill. They had a dizzy spell. They felt a weird pain. And when this happens, the first thing is you're horribly frightened. Your mind goes to the worst place. You look something up on the internet and it gives you an even worse place to go to.
Yeah.
But we offer is literally a phone call away from someone who knows you and
Yeah.
can really help understand, no, this is a problem and sort of talk you off the edge. Or if it is truly a problem, we can help direct your care. And it really illustrates what I tell the doctors, what I believe. Our overall goal here is peace of mind. We use healthcare to help you achieve peace of mind, but we're always very keenly aware that health of yourself and your family is the most precious thing you have, and that we really want to make sure you feel secure and at peace with how you're supporting in that. And I think having access 24/7 to somebody, it really goes a long, long way to giving people peace of mind,
Yeah.
even when they're not having an event, because they know it's there if they need it.
Yeah, absolutely. And so imagine I was actually had a medical issue when I was traveling in Europe earlier this year, and it was like, what do you do? But my typical experience is I would call the doctor's office. I'm not going to actually talk to the doctor. That never happens. I would maybe get connected to an advice nurse. Tell me about what happens when a patient calls Banner Peak Health.
Right. So an example, right. So once you're a doctor, I was a doctor, once you're a concierge doctor, I was a concierge doctor. So my mother-in-law could talk to you, is a Kaiser patient, and virtually any symptom that she would ever call in, the stock answer is go to the emergency room.
Okay.
And that's often many systems. They just really don't want to be able to do any medical decision making outside of the doctor's office. And then I
Okay.
become the son-in-law concierge doctor, and I'm then trying to figure out most of the time, no, you don't need to go to the emergency room.
Right.
So I'm always doing that. So what we do with Better Peak Health then is you have that access, and somebody could tell you, direct you where you need to go, where you don't need to go. And I said, getting back to that whole concept of peace of mind, most of the time we're getting people to calm down and not go to the worst place. I think societally we're prone to taking our minds to always going to the worst place. And I think information on the internet, I know healthcare information on the internet really always, I think, creates more anxiety than alleviates. Sure. And so we're sort of the anti-anxiety
You're
countervailing force in society,
it's sort of holding someone's hand
to help people calm down and right size things and guide them, and that they're not lost in the mass of non-contextualized information that we all swim in.
Yeah, absolutely. So someone calls in and they call the receptionist and then say, I'm having an issue. Can I speak with my doctor? And the doctor gets on the phone, or how does that normally work?
Sure, it depends. If you had a question about, why isn't my cholesterol medication back from the pharmacy,
right,
we would direct that to the pro. So we have triage criteria. And rest assured, if you have an urgent medical care, God forbid you can't breathe, God forbid you have chest pain, God forbid you have anything that the staff knows rises to the level of immediate physician assessment, you will have your doctor getting back to you and talking to you and assessing what you need urgently in your healthcare.
Yeah. And I guess it just occurred to me, what ages do you guys treat?
Yeah, it's a joke. I said, if you could drive to the doctor, we'll handle it.
Okay.
So, some people say 18, some people say 16.
Okay.
And it really goes. I'm proud. The oldest patient I've ever cared for was 107. So he was driving till about age 99. So I don't know if I'm going to replicate that. But we cover a wide swath of ages. Yes.
Okay, yeah. So you guys are used to seeing people in their 20s and then all the way up.
Exactly.
Okay. And then you've talked about how Concierge Medicine 2.0 is really looking at, I think you said prevention rather than treating illness. And I know that longevity is sort of a hot topic right now. And I see you've got the Outlive book right up there.
Right.
What are some of the things that you're doing with regards to longevity?
Right. I'm glad you pointed out Peter Attia's book, Outlive. I think it's been instrumental. I confess I've only read it twice.
Okay.
And he's really popularized this concept of people wanting to invest now in their healthcare to live not only longer, but a higher quality life. And
Yes.
That's wonderful, and we're definitely part of that. I was like sort of picking apart the meaning of words. And so if anyone who's read Peter Attia, I imagine, he's sold millions. People may have read it. He really goes this nomenclature, medicine 1.0, 2.0, 3.0. And I like to riff on that a little bit. And so he describes medicine 1.0 as occurring before the current scientific revolution in medicine. So I say medicine 1.0 is you get the disease.
Okay.
Medicine 2.0, he says, is the beginning of all the scientific developments we've had in the last 150 years. We've done a remarkable job treating disease. Medicine 2.0 is you treat the disease.
Right.
And then he goes on to emphasize his big addition to this metaphor is medicine 3.0 is you prevent the disease, and he's written the book and really popularized that mindset. I would like to coin the concept of medicine 4.0 where you optimize your health.
Okay.
Right?
Tell me
the
what that
first
means.
three is diseased focused, but if you really think about what you want, you would like more than not having a disease.
For sure.
You'd want to be optimally healthy. And that really gets into sort of some of the wearable technologies. It's more than prevention. Optimization is how well are you sleeping? How well are you exercising? How well, we could subdivide exercise. How well are you maximizing your resistance training to build necessary muscle mass? How well are you training for your aerobic capacity? And then the big area we're getting into, it's a very exciting development now for optimization, is how well are you handling stress? And it's a big part of what we're doing. Stress touches pretty much every aspect of our physical and emotional health. If the stress is out of control, everything else will be out of control.
Totally.
And what we're doing now is very much, the different wearables, we could then look for things like heart rate variability. We could put a number on stress. The adage is you can't manage what you don't measure.
Okay.
And there's been this concept both in the medical profession and among population, stress is bad for you, and everywhere stress, stress, stress. But until you could really come up with a way of quantitating it, it's really hard to have an endpoint with which to adjust your treatments.
Right.
So now we can have people wear rings and track at night what was their heart rate, what was their heart rate variability. And then we could have them track, well, what did you do that prior day? And we could adjust. Did you drink alcohol? Did you do zone 2 training? Did you eat dinner too late? Did you have dinner that has high carbs? It gives people the tool in real time on a daily basis to learn about their healthcare decisions and choices and how it impacts what's going on with their health. And they could rinse, repeat, modify, improve.
Yeah.
And it's a really powerful tool. And it's one that's really not being leveraged outside of the concierge medical movement. It's time consuming. But as we've talked about the whole day here, we have the time, we have the interest, and we can make it happen for patients.
And so they would have a wearable, and then you guys would actually sit with them to look through the data and explain what it means or what needs to be changed, or sort of come up with a plan for.
Exactly. And we're working right now with a platform where we're just automatically uploading. So just as a person will see their wearable data on their smartphone app, we then also have access to it in our office, and we can manage it and communicate with them around that. So
wow.
The technology is developing very rapidly, and it's really very exciting and gratifying for us to be right there on that leading edge of understanding it and incorporating in what we're doing. And as we're saying, this really is more about optimizing health than it is treating disease or even preventing disease.
Right.
And it's an exciting, gratifying place to be.
And then do you talk with people about their diets as well? Because you're getting all of this data on things that are happening, but do you talk with them about the food they're consuming and all of that?
Yes, and I'm going to tie back to an earlier question I'm going to answer, and that's another part of it. So right, the physicians are board certified in internal medicine, but as the purview of general medicine for adults, physicians are developing their own areas of expertise within internal medicine. And I know you've featured Dr. Ari Katz before. His superpower of expertise is this concept of really looking at how we eat and what we eat and how that integrates with our health. And he really has expertise with that. I know he's been in Walnut Creek Lifestyle talking about that. We've got a number of blogs. We put out a weekly blog in our website, and he's written extensively in that area. By the way, Dr. Lindsay Klein has recently been certified with the North American Menopause Society. Listeners may realize that there's been a dire shortage of qualified practitioners around the whole issue of perimenopause and menopause health care for women. She's now certified with area of expertise in that area. So though we are all generalists, over time, follow your intellectual interest and develop additional areas of expertise.
Specialty, that you can offer your patients.
Exactly.
So tell me, who is the ideal Banner Peak Health patient?
We provide value propositions for a whole variety of different groups of people at different stages in their life. I think one of the most common stories or scenarios of how people enter our clinic is there's this sort of, what do they say, naivete is a one-way street, right? You can't get it back. So is this sense of not quite immortality, but until something really bad happens to you or somebody you know, there's this sense that disease doesn't apply to me.
Right.
And so a classic scenario would be like a workplace where tragically someone will have a heart attack, often a man, let's say in his early 50s, and it's this, heads up alert that everyone around him, oh my God,
right,
there are bad things
right,
that can be happening to me.
Right.
And it enters people's consciousness. I need to pay attention to my health. I need to understand what my risks are, and I need to minimize my risk. And so that's a common scenario of how people seek us out.
Okay.
And there are other, scenarios. There's just, we've had scenarios where people have called us, just people can only be treated so poorly for so long before they give up. So another scenario, this is a real scenario, is someone literally called us driving away in disgust from an encounter he had had with his traditional doctor where he was like on a blood pressure pill. And he, I guess, had missed an appointment, had not been seen for 12 months, and said, hey, can you please renew my blood pressure pill? So no, we have to see you in the clinic. He goes to the clinic, and then the doctor was running so late that he had to cancel. And it's just, gosh. People can only be treated so poorly for so long before they realize they really want to be in a healthcare environment where their time is respected, they are respected.
Yeah.
We tell the joke that, your car mechanic probably treats you better than the staff of a traditional healthcare clinic.
Yes.
And people just don't want to deal with that anymore.
Right.
And so just give me these examples. There are many routes of how people want to come to us to receive care, but there's some examples.
Yeah. But would you say, you guys are fairly tech forward. So, and you're talking about preventing illness, preventing disease.
And optimizing health.
Is there an age at which you say, not a good fit for our clinic? Like, we do so much tech stuff that maybe this woman who's 70 is not going to be able to work with all the stuff that we provide.
Never, no.
Okay.
We are really proud of, and we'll stick with the mantra, it's never too late.
Okay.
So let's talk about sort of the traditional focus of geriatrics and the traditional fee for medicine. When you're in a disease-oriented model, as we grow older, if prevention isn't working, we do acquire more and more chronic disease to the point with, at a certain age, there's so much chronic disease, that becomes the entire focus of a time-limited encounter with a physician. And at any age, you could always improve your muscle mass and reduce your risk of fall. At any age, you can potentially enhance your sleep. In other words, it's never too late. And I think in particular, as people get older, they're really not optimizing the type of healthcare they can be getting because the clock is being run down by all of their chronic health problems.
Okay. So it's actually a good time to reach out and make that connection with you.
Oh, exactly.
Yeah.
It's never too late. And I think there's always something we can improve upon.
And then how often do people come see you?
It depends.
Okay.
As people have more chronic medical disease, there's a cadence. Every 3 months, we try to see everybody every year.
Okay.
But as again, I like to sort of parse these meanings of words. You use the word see, and there's a whole almost 100-year history of how medicine is funded behind the three-letter word C. That from the advent of health insurance in the 1930s, the billing was for a face-to-face encounter,
Yeah.
right? Where you had to see the physician for the money to change hands. Because we have a retainer fee, we are free to provide health care in the most convenient, most advantageous way possible for a patient. So in a given day, the majority of healthcare encounters are through texting, through email, through telehealth videos.
Wow.
And so the minority of time, you're actually seeing the physician. So I like to sort of expand on that one word because there are a lot of assumptions built into that simple question. And I want to say, no, we've stepped outside of that assumption.
Right.
And
we can sort of you can meet people where they are, or in a manner that's convenient for them.
Right. And we're not, again, the theme we've been talking about the whole day here is we are not constrained by what the insurance will pay for it.
Right. So you're really able to just offer
what people need.
Yeah. Wonderful. Yeah. So I guess what I'm wondering is there anything else that you think people should know about Concierge Medicine 2.0 or Banner Peak Health?
Right. So I tell people I'm not much of a basketball fan. I follow the Warriors only when they're in the playoffs. But in the last decade, I watched a lot of basketball.
Yeah, for sure.
We'll see what happens in the future, right? But so very much taken by the concept of strength in numbers. And so what I've seen in the 18 years I've been doing this, 15, 16 years in solo practice, now what I'm learning is the strength in numbers of being in a group practice now with 4 doctors.
Okay.
It goes to a variety of things. It just involves, there's cumulative many decades of experience. We're bouncing cases off each other. We're teaching each other. We talked about different physicians having areas of expertise that they're bringing to the group. It also allows me now more time to sort of put the chief technology officer hat on. And one of the challenges we've been talking about today is all this wonderful new technology.
Yeah.
The flip side of that is it is a needle in the haystack. There's a deluge of new technologies coming down the pike. And I would say only a minute percentage are really worth it.
Okay.
And so I spend a lot of my day researching what's worth it and what's not, and curating that. And all of this is possible because of the strength in numbers.
Yes.
We're together. In the traditional, which what I had for many years, the solo practice model, you are everything. You are the doctor, you're the business person, you're the chief technology officer, chief marketing officer. And no matter how dedicated you are, there's only so many hours in the day.
Right.
And so by having a larger staff, we could really accomplish so much more. And at the end of the day, I think provide a much higher level of technologically sophisticated care for our patients because we're a larger practice. I think that makes us unique.
Okay.
We're really leveraging that 3.0 to the maximum.
Right, absolutely. Okay, thank you so much for your time.
My pleasure. Lots of fun.